I work for UNICEF. I'm going to talk about what we do in India, in Chhattisgarh. Chhattisgarh has been working really very hard in improving the indicators, especially the health indicators all over the state. And this can be very much seen in the improvement of the various indicators like maternal mortality rate, infant mortality rate, as well as the other life expectancy being increased. But as this improvement, we see this improvement is not really pan state. There is a discrepancy when we look at the distribution of these indicators. So the districts which are up in the north and the districts which are up in the south, they bear a large burden of mortality in these areas. I'm going to showcase this discrepancy by sharing two examples. Imagine a pregnant woman who goes into labor in Raipur or Bhilai. Her parents pick up a phone, or the husband picks up a phone, calls up 102 or 108. Within 10 to 15 minutes, an ambulance arrives. The ambulance takes her to the nearest health facilities where the baby is delivered and she is safe. Now imagine the same scenario in a village which is in the middle of jungle in Narayanpur district. The woman does not have an access to a telephone, or there is no road access where she can go. She only has two choices: either to deliver the baby at home without a qualified care, where she puts her life as well as the life of her newborn at risk, or other alternative, which is improvised transportation. This is something which is a reality in this part of the country. It's a bamboo on which they tie a woman and they take her to the nearest facility using the mountainous roads. Or it's a party-like structure where they carry the woman on 4 shoulders. As UNICEF, we have been traveling in these areas extensively. And I remember traveling in these areas in a 4x4 vehicle to cover 40 kilometers. And it took me 10 hours to cover these 40 kilometers. And this is Chhattisgarh I'm talking about. And it's not very long ago, it's just a year back. If I were to show you the road conditions, this is how it looks inside Abujman. So what do you do in this kind of a situation? Also working in these areas, I realized that one of the mode of transport which was reaching all these areas was a motorcycle. You see the motorcycle? The motorcycle is used in these areas to carry goods as well as men to the innermost areas. Now how can I use this mode of transport to carry a pregnant woman and a baby to a hospital? That was a challenge. You see, when we grow up, many things as we grow up, we learn, we see, and that affects how we do things when we grow up. You remember, there was a famous movie which kind of has stuck with me for a very long time, and I need to thank Bollywood for giving me an inspiration for designing what we did here in Chhattisgarh. Do you remember this famous picture? So the idea was very simple. Take a motorcycle, put a sidecar, not a sidecar, rather we thought let's put a bed around it and let's see, does it work? To operationalize this, we went into a partnership because we don't do these things ourselves. We went into partnership. We looked for an NGO. Started working with an NGO from Kondagaon named Sati. Together, I sat with Bhupesh Tiwari, who is the president of that NGO, and we finally came back onto this design that we will use this design. We will take a motorcycle and a sidecar and build on it. We took the help of some mechanics from Visakhapatnam to build the first prototype. And it came out like this. This is actually a motorcycle with a bed attached to it. Simple, nothing fancy about it. Well, while we were doing this, we kept some principles in mind while designing this. First, this thing or this prototype needs to be simple. Second, it needs to be able to be built locally. Third, it needs to be maintained locally. And the fourth, which was the most important thing, that the driver which will drive this motorcycle needs to be a local boy. This is the tribal boy we said, we pick up a tribal boy from those areas who knows these roads, who knows the people out around there, and can go there without any hitch. We also decided to use this motorcycle ambulance for pregnant mothers and the newborns, so that neither the police nor the Naxals object to it, because it is a people-oriented intervention. You know this boy, his name is Krish, and he's a right now social media celebrity. He's on WhatsApp, he's on Facebook, he's everywhere. He's in newspaper. He is actually helping us save lives. He goes wherever he is required to go to save lives. This motorcycle ambulance is stationed at a PHC, which is in the innermost areas, because telephones don't work in these areas. So anybody with a motorcycle comes to this PHC and asks Suresh, let's go and bring the pregnant mother. He goes and brings these women out of these areas so that they can get qualified care. As UNICEF, we realized that it is not about the lack of health facilities. It is about the lack of access to these health facilities, which was the problem. So the first motorcycle ambulance which we built is here. It's a stock 125cc motorcycle TVS, which we bought from a showroom and then built onto it. The cost of this motorcycle ambulance was 1.75 lakhs, and the running cost per month worked out to 15,000 rupees per month, which actually, if you calculate, is only 15% of a normal ambulance which works under 108, 102. So it was also very cost effective. From the inception of this project, of the prototype, we realized that when we work on this, it's an idea. We need to look at it, and it will have its deficiencies. We were in tune with that. We took the feedback from the driver. We took the feedback from the people who were using it. And some of the deficiencies which came out very clearly was that this lacked power. Second thing which came out, that it has a tendency to turn towards the left, which was disturbing the stability of it. Well, if we have engineering students in our audience, they will know that the center of gravity of a motorcycle is between the two wheels of the motorcycle. And when you add the third wheel, the center of the gravity moves out of it, and then there it has the tendency to go left. We worked with mechanical engineering department, NIT Raipur, to improve the design on all the flaws which were pointed out by the driver as well as the users. And we came up with this revised, I would call it motorcycle ambulance 2.0. And this is the structure where we said we want a structure where we can just put in a bike here and bolt it in so that it can run. This is now how it runs. It runs with a Pulsar 220 bike, again a stock bike. This bike is going to those difficult terrains where no other vehicles go and bring out pregnant mothers to the safety of the health facility where they can deliver and save the newborns. As of today, we have 2 of these motorcycle ambulances which are working in Abuja district together with our partner Ramkrishna Mission. Looking at the social media and the coverage in the news, District Collector Dantewara contacted us. He said, I want to build similar motorcycle ambulance for Dantewara district, and we are in the process of now operationalizing the 4th motorcycle ambulance which will be functional in Dantewara. You see, this motorcycle ambulance is filling a niche gap of last mile. Government is already running 108 and 102. This motorcycle ambulance fills in a gap of the last mile and very ably complements the government 108, 102 and has shown dramatic results in increasing the institutional deliveries in the district where this is working, and thereby it will also show results in reducing the maternal and newborn mortality. As UNICEF and as an innovator, I would like this, and the person who would like this idea to be copied as much as possible. I am aware of similar prototypes running in Orissa. There was an ad campaign run by Bajaj also of similar thing running in West Bengal. Maharashtra is interested in running a similar prototype, and other states are also showing interest in replicating it. And we want students like yours and the faculty here to look into how you can innovate in these areas. We have shown that an idea works and it saves lives. What does it translate to? In the past 1.5 years, this motorcycle ambulance has pulled out 455 patients, out of which more than 85% of the patients have been pregnant mothers and newborns, which is a huge thing, because these areas, if you remember I showed you, are the areas where access is a very, very big problem, and that's why this is really helping. I want this motorcycle ambulance to change lives. I want this motorcycle ambulance to also take up a new avatar, to start work in transportation of critical medicine and vaccines to these areas. We will be working on those models very shortly. And in the end, I would like to say, this motorcycle ambulance is an example of UNICEF's commitment to saving each and every newborn and mother's life anywhere else in the world. I would like, in the end, to thank a few people without which we wouldn't have reached where we are. First of all, this partnership, this motorcycle ambulance was run in partnership with the National Health Mission and the Directorate of Health Services from day one, keeping in mind that if it works, it can be upscaled in the state, and that is what is happening. And I would like to thank the government for taking it forward from where we have just demonstrated that this works. I would like to thank Bhupesh Tiwari and his team from Sati and our RKMA team who are running this actually on the ground and saving lives on a day-to-day basis. And I would like to thank the environment which is created in the state for helping us as UNICEF to innovate to save lives. And last but not the least, I would like to thank my boss. Usually that is done at the end of the speech. Because he helped me to, he believed in when I said I want to put a bed around a motorcycle. Because there were many people who said, well, what are you talking about? What rubbish? This is not going to work. There is so much data. But Prashant Das allowed me to do this, and this is one of the success which is now ready for replication. It's an idea ready for replication across the country. Thank you.